There are several potential health benefits to transitioning to a circular economy. One of the key premises of the circular economy is that waste from one system serves as a nutrient, food, or fuel for another. And this means that the circular economy has the potential to dramatically reduce pollution, basically another word for waste. So everything that's now dumped, either into water or air or a landfill, that basically points to a system that could be redesigned to transform that waste into food. Another potential health benefit derives from the efficiencies of closed-loop systems. So anytime you use less energy, you generate less air pollution and cause, therefore, less heart disease, less asthma, fewer strokes, fewer upper respiratory infections, all kinds of direct health benefits of using less energy. So take, for example, the building industry. There's a recent life cycle assessment that looked at the impacts of construction and building materials, the building industry writ large, and pointed to this industry as the user of an incredible amount of resources, 40% of the world's natural materials, 40% of the primary energy, and similarly, it's the producer of nearly half of all greenhouse gas emissions. Closing the loop on this industry alone would have an enormous impact. There are a few potential downsides to a circular economy. If we simply close the loop on the current economy, that risks trapping hazardous chemicals into a cycle of reuse. And it can even lead to increasing human exposure as chemicals are incorporated into new products or processes. They go from being in one system where there wasn't much anticipated human exposure to potentially being in a product where there might be a tremendous amount of human exposure. It's particularly true of chemicals that are PBTs, that is, persistent, bioaccumulative, and toxic. These are chemicals that last in the environment for years or for decades. They accumulate in organisms, that is, they magnify through food webs, and they're hazardous to human health or ecosystems. So some examples of these PBTs include halogenated flame retardants. These are ubiquitous in electronics and in polyurethane foam. And recycled foam can often go into carpet backing, or recycled electronics can go into plastic kitchen utensils. These are two uses where we've seen flame retardants show up in materials that they were never added to, and that can potentially dramatically increase human exposure. In fact, the ecosystem and human health benefits of a circular economy, I would argue, can only be realized if the material basis of society is basically non-toxic. One example is a project here at UC Berkeley investigating safer ways of making recycled modular roofing tiles. An initial product that was made from compressed recycled cardboard excelled in terms of recycled content, but it relied on perfluorinated chemicals to make the roofing material water resistant. That's a key design feature in roofing, but one that ended up coating recycled materials with a PBT, a persistent bioaccumulative toxicant. So researchers here at BCGC have produced a water-resistant coating that works on the cardboard tiles based on stearic acid, basically soap. It's significantly safer, and it also uses a byproduct of slaughterhouses. So it's an example of using waste from one process as feedstock for another. Another potential downside of a circular economy is that without a global perspective, we could end up improving conditions in one area while dramatically worsening them in another. So in closing the loop, we need to be especially mindful that hazardous materials are not dumped into neighborhoods or parts of the world where environmental regulations are weaker. We also need to ensure that work isn't outsourced to areas where workplace safety lags. E-waste recycling has become sort of an infamous example of the horrendous conditions it can create for workers and surrounding communities in many areas of the world, in India and in Asia and in Africa. E-waste recycled informally is done in ways that are tremendously toxic, both for the people doing the recycling and the surrounding communities. There's burning plastic that produces dioxins and solvents containing heavy metals that are dumped into irrigation canals. So for a closed loop system to really succeed, we have to be confident that the materials in it are safe, and we have to use recycling processes that are safe for workers. There are a few things that we can do to maximize the potential that a circular economy will really benefit public health. The first is to phase out chemicals of high concern. So there are some materials that simply should be retired, that should never enter a recycling waste stream, and some materials that a safer version of them would be excellent in the waste stream. The second way is to keep a global perspective, to keep from shifting risks from one population to another. And the third way of maximizing the public health benefits of the circular economy is to design new materials and products in anticipation of their entering a closed-loop system. To do this, we need to understand several things. First, we need to understand what is in products, what's in materials, and what's in finished products, what's in buildings, what's in assembled electronics. Without knowing what's in them, we risk introducing hazards into the waste stream. And second, we need to understand the health and environmental impacts of chemicals so that we know what's bad, what's better, and how we can safely use existing materials.